Hello everyone, I'm Dr. Mike Blaney, a general and bariatric surgeon at Live Healthy MD in Augusta, Georgia, and today we're going to talk about revisional weight loss surgery. So what is revisional weight loss surgery? Revisional surgery is changing from one previously performed weight loss surgery to another. And oftentimes my patients will come in asking to have another surgery performed. The most common reason that this might be asked, unfortunately, is weight regain. Occasionally there may be complications or side effects from a previously performed operation that might necessitate revising an operation. So today we're going to talk about the various scenarios that can come up with the various procedures. Let's first start with gastric banding. Gastric banding is probably the most common procedure that is revised, and the reason that we would change from a gastric band to one of the other operations most commonly is poor weight loss. But other times we've found patients have band slippage, which is a complication from a lap band that might necessitate removing the band. So the types of gastric band revisional procedures might include removing the band and replacing the band at a later time. That's most commonly done because of band slippage. More often, however, an individual's had poor weight loss and they want their band removed and converted to another operation. So the gastric band can be removed and converted to either a sleeve gastrectomy, a gastric bypass, and even a duodenal switch. The sleeve is also performed and can be revised as well. The most common reason I find that a patient may need to have a sleeve revised to another procedure is reflux. Unfortunately, a sleeve gastrectomy sometimes results in an individual having significant reflux or regurgitation. Although this is not very common, it does happen. So a sleeve gastrectomy can be converted to a gastric bypass or a duodenal switch in the situation where an individual may have had unsatisfactory weight loss. And what about the gastric bypass? Sometimes we'll see our patients come back after surgery and have weight regain that's significant. Unfortunately, revising a gastric bypass to another procedure is generally not recommended. We can technically convert a gastric bypass to a duodenal switch, and we've done this in rare circumstances, but it can be done. Generally speaking, if I have a patient who has experienced weight regain after a gastric bypass, we try to get them back on track with their weight loss through non-surgical means. If they are significantly overweight, have regained the majority or all of their weight back and suffering from serious medical problems associated with their weight, I might consider that an individual a candidate to have their gastric bypass converted to a duodenal switch. Duodenal switch operation generally cannot be converted to another procedure. And the majority of the time individuals after this operation rarely have issues with weight regain. If they do, that would be highly unusual, and it's usually related to behavior that needs to be addressed prior to considering any further weight loss operations. I've had patients come in after various procedures and ask about the gastric balloon. You may have heard of the gastric balloon as a weight loss procedure. It's a balloon that's placed in the stomach to occupy space and result in fullness, early satiety, eating smaller portions, and hence losing weight. The gastric balloon cannot be used as an adjunct to these other procedures. So we cannot place a balloon in a patient who's previously had a sleeve or a gastric bypass or a duodenal switch. If you like this video, please subscribe and give us a thumbs up.